Okay, so I'm recording this video just because I think a little bit giving the history would be easier. Sometimes just looking at a computer, it's a little bit painful. So this is the history. Apologies. There's a lot of information, but I think it can be helpful. So that's why I think a video. I've had different episodes, and the first one happened in February. And to be fair, I've never had something like this. So I was just I was traveling in Europe. I had a nose blocked and didn't really treat it. Thought it was just a cold that would pass. Then when I got here, eventually got to the doctor in March, and they said, "Hey, you need to, this is actually it has become it's a sinus, but it has become a kind of a lung infection." They did do sorry, here I have it, a scan of the lungs. That's the only time that they've actually done something beyond. They've used, let's say, technical equipment or external equipment. Um, and basically they said, "Hey, it's gone to the lung. Let's give you a treatment." I'm a little bit confused, and my memories are blurry of this. Okay, but in principle, that didn't last more. In May, I had a second round. It was a short one. I'm putting 10 days of symptoms. Here I'm putting long symptoms because it's true that I'm not used to being this. I'm used to just having colds, and okay, they pass after 3 days, so I would always keep on going. Okay, blocked nose, starting to lose voice when I talk. And I started to do the rinsing. And they already told me this time, like, "Hey, this is important. If your nose gets blocked, just do the rinsing." We were doing it for my daughter, never thought about it. And in both cases, they gave me antibiotics. Then this is the real round that really has really gotten to me. In September, 14th of September, sinus infection, intensity relatively low. This was I just felt sick, and I was going to Singapore for to spend 2 weeks, and I was like, okay, I did feel the symptoms maybe 3, 5 days before. They told me it was bacterial. I have to just check the paperwork, and I don't have it right here because they don't give you very the descriptive documents. And I had a strong green phlegm already, and no loss of voice, not feeling so sick in that sense. Okay, well, a little bit of loss of voice, but not. And then doctor just gave me antibiotics, nose rinsing solutions, and antihistamines. It was an ENT doctor. Okay, October, well, end of September, come back, and they actually tell me it's in the lungs. Hey, don't go see the other doctor. So I go to see a lungs doctor. Still recommends the nose rinsing and gives me antibiotics plus a bronchodilator. Okay, that here you have the picture of the bronchodilator. I think it's here. No, sorry, here. They're the pictures, if you want them, are here in more detail. Okay. Um, lungs. In all these cases, the only thing they've done is observation through one of these devices with tube, with light. Look to my nose, look to my ears, look to my throat, try to see, and basically saying, "Hey, there's the white kind of substance that indicates white, green. I'm not sure. That indicates that you have the infection." Okay. And in both cases, okay, don't worry, take it, and you'll be fine back. Come back in November again, have it again. Nah. In this case, I go to another ENT doctor, a first ENT doctor, um, and I start to get a little bit desperate because he gives me another round of medication. I'm a little bit lost if it was 6 or 7 rounds of antibiotics that I took because I'm confused if he gave me or I just told him, no, I need to talk to another doctor. But I knew I was sick again. I knew I had the symptoms already. They were starting to be, and here, adding more kind of tiredness and dizziness. The longer it goes, the more I'm starting to be like I'm more affected. Okay, then household changes. Sorry, apologies. I zoomed in too much, so now I can't unzoom. Okay, actually, important on this. I met Dr. Jasada. He actually started to give me a stronger treatment, and what he said, and important, by myself, I got an allergy test. Here, they don't seem to be to care. No one wants to go for the source, try to find the source of the problem. I did the allergy test. The allergy test is also in the treatments. Small reaction to mold, cat fur, horse skin, whatever. Major reaction to dust mite, like 3 or 4 times bigger than the rest. So then we did do a bunch of changes in the household, changed the bed sheets, cleaned a bunch of areas. The house is very big, and we don't have a full-time cleaner. Our nanny does nanny work. Um, and we have the air purifier in the room. We already had that, but well, kind of going on that route. Okay, I got sick again. And now massive green phlegm, irritated voice. You see now, I get tired when I speak. dizziness, tiredness, a bit of head pressure. It's starting to get into, I'm starting to have, now, for example, I'm putting in January even more. I even feel like a headache. Um, Dr. Dejada, we tackle short-term issue. He insisted, Dr. Dejada, okay, we need to do two things. I'm gonna tackle the short-term issue, which is a bacterial infection, through massive doses of antibiotics. He gave me antibiotics, anti-inflammatory, anti-congestant, all pretty strong. I was so strong that one night I fainted, and because I was really low, kind of pressure, low blood pressure, or something happened. And he said, look, it's a little bit strong, but we got rid um we tackled the short-term one, which is the bacterial infection, but you still have the long-term, let's say chronic sinus inflammation. And that, let's see what we do. He basically recommended this, the saline solution plus Plumicort, which is budesonide corticoid. Sorry, budesonide corticoid. Okay, here we close the parenthesis. Okay. Um, and he basically said, okay, use this and we see what happens. I was getting better by before that bacterial infection had stopped for the first time since September. The bacterial infection stopped. Oh, sorry, I am not feeling well. Stopped for the first time. I still had some mucus, but much clearer. Everything was feeling better. Dr. Zad just said, need to wait and see. Um, Doing the nose dressing plus Plumicort to try to see if the chronic inflammation would subside. Um, the challenge, the big problem is that we went to Singapore. The air was actually much purer. We're feeling much better. And I stopped having any mucus. My daughter also. It was amazing, but big mistake. We went to a water park, and my wife didn't have any equipment. Well, I always do the activities with my kid. This happened. She should have done it, but well, I did the activity with her. Got a cold. She got a cold, my daughter, and got rid of it in 2 days. I reactivated all the inflammation, all the bacterial inflammation, bacterial infection. Now, while I'm here, is I'm going to see Dr. Jesada, okay, today, no, tomorrow, 14th of January. He's probably going to give me antibiotics and inflammatory, all the nonsense. I'm a little bit afraid because that's basically what they gave me here. But he did said, look, no matter what, there's two things. There's the bacterial infection, and that's antibiotics. So I know what he's going to give me. But for the chronic inflammation, he also said that no matter, unless it cures by itself, which I don't see how this will cure, especially in Thailand because the air pollution is higher. Okay, I send you here a link that you have, and here you can see that the hospital where I'm visiting all these doctors, supposed to be one of the best in Thailand. But as always, they very narrowly focused on, hey, okay, let me give you some pills, let me get rid of this. But he recommended, you see, my throat is killing me now the more I speak. He wants to give me 3 months of low-grade antibiotics, even to get rid of the chronic sinus inflammation. And that's what freaks me out a little bit because thinking of again more antibiotics and all this is just. But well, I need to fix this. I need to fix this because now, as I was saying, in my symptoms, massive green phlegm. Now the green phlegms are enormous. Loss of irritated, and after long conversation, this is not even a long conversation. I'm already losing my voice. A bit of head pressure, but now we're going into even a headache. And now I have a little bit of, and I'm freaking out because I've had meningitis once in my life. Having a little bit of neck pressure, a little bit. It's just soft, but I'm getting the dizziness and getting tired. And I'm really, I barely can do anything right now. So this is a little bit my situation. If anyone can give me good advice, I would just Pepe. I know what to say. I'm a little bit desperate right now. And that would be amazing on where to focus. Right now, my alternative is to go to the doctor tomorrow. Depending on what he says of the gravity, I'll stay here. My father's coming on the 24th of January. He's staying for 10 days, and then we will go to Spain. So that kind of delays treatment for a month, or I would just go to Spain and try to get treatment in an environment with much better air quality and with doctors that are better at generalist kind of treatments and not this kind of hospital being dumped in a specialist, which I mean, they're great professionals, or I think they are, but it's just the narrow focus. No, for example, just in terms of an example, they've never recommended anything for my gut. No probiotics. I'm having, for example, I missed to comment here. I'm having a chlorella, probiotic, psyllium husk, or I don't remember the name of it, but I'm having all this kind of recommended, searching online to try to improve my kind of overall health. Thank you so much. I hope to find a solution, and I pray for it. Thank you.